Good morning and welcome to the National Press Club. I'm Michael Friedman, the 113th president of the National Press Club. I'm the former general manager of CBS Radio Network, now journalist in residence at University of Maryland Global Campus, and executive producer of the public broadcasting series The Kalb Report with legendary journalist Marvin Kalb. I'm joining you today from the National Press Club Broadcast Operations Center here in Washington, D.C. Our guest, American Medical Association President Dr. Patrice Harris, joins us virtually from Atlanta. Dr. Harris is serving a one-year term as the 174th president of the largest association of physicians and medical students in the United States. She is the first African-American woman to hold the position and brings to the role several decades as a physician in private practice, as well as a public health administrator, patient advocate, and medical society lobbyist. When she took office in June of 2019, Dr. Harris pledged to bring her work on the front lines of the opioid crisis to the forefront. Today, of course, Dr. Harris is here to talk with us about an entirely different public health crisis and why, in this era of conspiracy theories and fake news, she believes we must return to a reliance on scientific facts, data, and trusted sources. Dr. Patrice Harris, welcome to the National Press Club. Our virtual podium is yours.
Thank you, and greetings. I am Dr. Patrice Harris, President of the American Medical Association. The coronavirus pandemic presents a challenge the world has not faced on this scale for generations. It's often said that extraordinary times call for extraordinary measures, and we are witnessing every day the heroic efforts of physicians, nurses, medical workers, public health professionals, and the public to manage the enormity of COVID-19 in our communities. But extraordinary times often call for the most basic of responses. For physicians, this means the routine collection of facts and evidence and examination of research that has been foundational in medicine since its origins. We live in a time when misinformation, falsehoods, and outright lies spread like viruses online, through social media, and even at times in the media at large. We have witnessed a concerning shift over the last several decades where policy decisions seem to be driven by ideology and politics instead of facts and evidence. The result is a growing mistrust in American institutions, in science, and in the council of leading experts whose lives are dedicated to the pursuit of evidence and reason. In these challenging times, I am addressing the nation to make an appeal for science in defeating this disease, to explain why physicians and scientists rely on facts and evidence in carrying out our duties, and to remind the public of its responsibility to help turn the tide against COVID-19. I know people are frightened. You are afraid for yourselves and for your family. You are concerned about catching the virus, and you are worried about spreading the virus to others. Many of you have lost jobs or are trying to keep a small business afloat. Many are working from home and caring for children whose schools have closed. You have missed graduations and milestone birthdays. As a psychiatrist, I understand the fears and sense of loss we are all experiencing, and that they are weighing heavily on our minds and affecting our mental health. Fear and anxiety are natural human emotions in a time of crisis. But as we have seen in the last few weeks, panic can lead to troubling consequences: hoarding of food and supplies, spreading of misinformation, and mistrusting the motives of others. It is absolutely okay to be afraid, but please do not let panic guide your actions. And so, on behalf of our nation's physicians, I ask you to respond instead with reason and resolve. Physicians, nurses, researchers, and public health experts throughout the world are working tirelessly to contain this pandemic, to develop new tests, to develop treatments, and to create a vaccine. But this will take some time. In the meantime, we must exercise good judgment, believe what the science and evidence is telling us, and be flexible in changing our behavior as our knowledge improves. We do not yet know everything we would like to know about COVID-19, but there is plenty we do know. Transmission occurs primarily from person to persons in close contact. Anyone can become infected. This virus does not discriminate. Seniors and those living with chronic disease are much more vulnerable to serious illness from this virus than others. Many more people are carriers for COVID-19 than have been tested, as they may be asymptomatic or experiencing only mild symptoms. They pose a risk to others. So the most effective tool we have in this fight at this moment is physical distancing, which means every city and state that has not yet implemented shelter in place or stay at home restrictions needs to do so immediately. Based on what we know and what has already worked in other countries, and indeed in our country, this is our best chance to slow the spread of the virus. As a physician, I am honored to be a member of one of our country's most trusted professions. People trust their physicians because they know we do not act on whims or hunches or personal opinions. We take an oath to treat people ethically, and we go where the evidence leads. Now, this was not always the case. The origins of modern epidemiology date to 19th century London, when a physician ended a severe cholera outbreak long thought to be the result of breathing bad air. By studying the location of cases, he discovered the real cause was drinking water from a public pump that had become contaminated by sewage. The American Medical Association itself was founded in 1847 as a response to rampant quackery in medicine. At the time, syrups or serums were sold as cures for various diseases that not only did not help, they often caused harm. The AMA fought to center the practice of medicine around a set of established standards and principles and to develop a code of ethics. And our mission since then has been to promote the art and science of medicine and the betterment of public health. The role of America's physicians in this pandemic is, of course, to care for patients with COVID-19 using the best, most up-to-date evidence available. But as skilled as physicians and other healthcare workers are, and as hard as they are working in our hospitals and clinics and offices and intensive care units, they cannot carry this burden alone. Everyone has a role to play in containing this pandemic. The strategies we are asking the public to universally adopt may seem simplistic, but they are, in fact, based in science and evidence. Physicians and public health experts are asking everyone to wash their hands, for example. Now, children learn even before preschool that washing their hands reduces the spread of germs. But how do we know this? The evidence. It may be hard to believe, but in the mid-1800s, many healthcare workers did not wash their hands between patients until the link was made between hand washing and a reduction in disease. Many women died before studies found that maternity patients had a lower risk of disease and death if their physicians wash their hands between patients. Hand washing became a necessary protocol for physicians and now more than ever for everyone in society. We are asking for social distancing, or as I prefer to call it, physical distancing, because we can and should still strive to have meaningful social interactions while maintaining a safe physical distance. We know this is very difficult for people, but we know from history it is effective. A century ago, the United States and the world faced a pandemic of influenza known as the 1918 flu. Major cities varied in their approach to physical distancing, and as a result, their death rates varied widely. As described recently in National Geographic, Philadelphia reported its first case of influenza on September the 17th, 1918. Days later, they held a war bonds parade attended by 200,000 people. Sadly, 2 weeks later, at least 20,000 city residents had contracted the flu. Now, contrast Philadelphia's approach with that of St. Louis. St. Louis had the benefit of watching what was happening on the East Coast, and public officials acted quickly. 2 days after the first case was reported, the city of St. Louis shut down. Two cities, two different approaches to physical distancing, and two different death rates. By the end of the epidemic, St. Louis had half the death rate of Philadelphia. So let us use the experience of a century ago as a guide for today. If the citizens of Philadelphia knew then what we know now of the direct link between a large social gathering and a spike in cases, there is little doubt that they would have chosen not to attend that parade. We are also asking that physical distancing measures not be relaxed prematurely. We understand that people are suffering great financial and emotional pain in having much of the economy shut down, in not being able to gather with their loved ones. Here, too, the evidence from the 1918 pandemic is instructive for today. A retrospective study in the Journal of the American Medical Association found that non-pharmaceutical interventions, such as school closures and bans on public gatherings, were beneficial and should be sustained throughout the peak of a pandemic. Further, cities acting in a timely and comprehensive manner experienced lower death rates. The AMA is encouraged by those federal and state leaders who are willing to keep physical distancing restrictions in place until the evidence suggests it is safe to return to normal. Today, we repeat our call for governors who have not yet implemented physical distancing in their states to do so immediately. Now, in truth, the nation needs more, much more, from our leaders. The public is already making incredible sacrifices by acting on the evidence. All of us need to trust that our institutions are also keeping science at the fore of their decision making. And so, with that in mind, the AMA calls on all elected officials to affirm science, evidence, and fact in their words and their actions. We call on media to be vigilant in communicating factual information from credible sources and to challenge those who choose to trade in misinformation. We call on tech platforms to advance evidence-based information from credible sources and reduce the spread of misinformation. We call on our government scientific institutions now and in the future to be led by experts protected from political influence. We call for an environment in which physicians, scientists, and other experts are free to communicate evidence based factual information without fear of retaliation or retribution. We call for determinations about safety and efficacy of drugs to be made by scientists and researchers based on the data, and that treatment decisions should be made via a shared decision making process between a patient and his or her physician without intrusion by any third party, government, or otherwise. We call for the robust collection of data, including data segmented by race and ethnicity, to make sure we have a thorough understanding of the pandemic's impact on every community. Some have called the response to this pandemic a war. We must ensure the war is against the virus and not against science. Despite solid evidence behind the public health measures now in place, misinformation about COVID-19 is spreading rapidly, even intentionally, due to fear or to various political agendas. You may have heard some of these false claims yourself. African Americans are less likely to get COVID-19. That is false. Coronavirus is a new way to force vaccinations on people who don't want them. Also false. And children cannot contract COVID-19. False. Believing these kinds of rumors and conspiracy theories inevitably leads to more illness, more suffering, and more death. And that's why we all have a responsibility to seek out and share information only from credible sources. America has faced and overcome enormous public health challenges before. Greatly reducing smoking, finding treatments for HIV and AIDS, eradicating polio and other vaccine preventable diseases. Challenges that required changes in thinking, changes in public policy, and changes in behavior. We must approach COVID-19 in the same way, by relying on the science and evidence to inform our decisions and our actions. With this new pandemic, there are many unknowns. It is critically important, however, that we go back to the core principles and core knowledge we have relied on in the past. As evidence evolves, necessarily our strategy, tactics, and behaviors should change accordingly. It is science, research, and evidence, and not wishful thinking or ideology, that gives us hope as we face uncertainties around this pandemic. It is science that will bring about proven treatments for COVID-19. It is science that will bring about a vaccine. Every person in this nation shares accountability in fighting this virus, and we all have a responsibility to do our part. At times like these, we may feel a sense of helplessness or hopelessness, but we are not powerless in this health crisis. We must all commit to evidence-based actions to fight this disease. In closing, I offer my most heartfelt thanks to all of the physicians, nurses, and health professionals who are heroically fighting this pandemic. I also want to thank those who are cleaning our facilities and cooking our meals and delivering our food. And finally, to all of those who are taking the necessary steps to keep themselves and their loved ones safe. Thank you.
Thank you, Dr. Harris. I now have a series of questions submitted by members of the National Press Club. For those of you joining us by live stream today, you're also welcome to submit questions online, and I will ask as many as possible. I'd like to first tap into your expertise as a psychiatrist. You talked about the emotional and psychological impact of the coronavirus crisis and how we can all best deal with that. And you mentioned changes in behavior, which are generally easier said than done. How does one calm oneself down right now? What are some practical ways that people can remain reasonable in the current situation?
Well, just a few practical tips, and I urge everyone to rely on their usual coping skills. I think the first thing is to make sure you have reliable information. Misinformation often leads to fear. I do tell everyone, myself included, that sometimes you just have to take a moment and breathe. Every morning, I would take a few minutes to get centered on the day. Sometimes you have to, cut off the television and take a break from social media. We should all be getting exercise. If you have the privilege of being able to walk safely around your neighborhood, get outside again, keeping in mind that you want to make sure you are doing the appropriate physical distancing. Um, but if you can't, you could exercise indoors. I say put on your favorite song and just make sure you keep moving. We should all try to get as much sleep as we can and eat as healthily as we can. So those are just a few tips, and really experience those feelings. No one should beat themselves up for being more anxious or worried. Those are normal feelings. And I'll just say one more thing. There is a huge disruption in our routines, and so it's probably a good idea to develop new routines because routines also will help us get through some of the fear and the anxiety.
A lot of people are finding new routines, not necessarily by design, but by necessity. They may be working from home with a spouse or partner and perhaps with children around them who are now being distance schooled for an indeterminate amount of time. Your training is in child and adolescent psychiatry. What should, first of all, we be telling our children, our grandchildren, to help them best cope with this, and talk a little bit about dealing with this in this forced new environment that a lot of people find themselves in?
I think the first thing parents should commit to, parents and other caregivers, is to have age appropriate conversations. And children and adolescents guide us in their conversations, answer their questions, but certainly in age appropriate ways. I also think we should all be careful not to ascribe feelings, particularly to our children. For example, rather than saying, I know you are afraid, you don't want to lead with that because, in fact, they may be curious. They may not be afraid. Certainly, I believe initially maybe our children and adolescents were happy maybe for a school break. And so rather than ascribing feelings, we should say, how are you doing today? What routines, what would you like to do? What do you think about our new routine? I mean, ask open ended questions, get feedback from them, and then provide age appropriate information. I do think, though, and worried, but be mindful that our children are watching. And if you're anxious, they will get anxious. So again, not recommending that parents or caregivers hide their feelings, but certainly be mindful that our youth are watching.
Have you been in touch with the White House? And a second part of that is who from the administration are you listening to with respect to COVID-19?
Well, certainly early on, I had the opportunity, along with some other leaders of physician organizations, to participate in a conference call with the president and the members of the task force. And at that time, we were able to bring up concerns from the physician community. And since then, I've had other conversations with some members of the task force. And listen, as president of the American Medical Association, I have to listen to everyone. I listen to physicians across this country who email me, who call me, who text me. I review the media post. I listen to the media briefings because certainly, as the physician leader, I want to be informed. I want to hear from everyone. Certainly, we at the AMA, and of course, we have a fantastic team at the AMA. We have our team in DC and our team in Chicago. We are monitoring every bit of information, synthesizing that information, and making sure we get out credible sources of information. We have a COVID-19 resource page on our website, and we want to make sure we are supporting physicians. That's why early on in this, we sent letters, and we have sent many letters to Congress and the administration. We want to make sure that physician practices, large and small, are supported during this time. Physicians are reducing hours. Certainly, we are able to, again, thanks to CMS, using telemedicine, but certainly it's had a negative impact, of course, on physicians on the front line, but throughout this country. And so I listen to all information so I can best learn and know how to support not only our physician community, but ultimately the patients that we serve.
Tying together a lot of the things that you said in your talk and asking people to stay reasonable and calm and not panic in this. Reports out of the White House suggest that officials disagree over the use of the malaria drug hydroxychloroquine as a possible treatment for COVID-19. What's the AMA's position on that drug as a treatment for this virus?
Well, I think our position is our position that you heard me speak about throughout my address. Science and the evidence have to rule the day. And when we make treatment decisions about COVID-19 or any other disease, physicians base those recommendations, of course, in a shared decision making process with our patients on the evidence and the facts. And so we certainly want the process to play out. Now, absolutely, clinical trials are going on right now. That's how we get the data that we need. And some of those clinical trials are using hydroxychloroquine, and that is appropriate. We know there is compassionate use. But whatever the situation, physicians don't make recommendations, treatment recommendations, as you heard me say earlier, on whims. There is a decision-making process that physicians go through for every treatment that we recommend, and that should continue to hold through for COVID-19 and anything else we face in the future.
Let's talk about the impact the virus is having demographically. There have been multiple reports now that minority populations in the United States are bearing the brunt of the virus due to being the majority in densely populated cities. Is the AMA tracking this at this time?
Well, another area where we absolutely need to make sure we have the data, which is a recommendation that we are making, is to track this data by race and ethnicity. Clearly, the first 8 deaths in Milwaukee were all African American. We learned last evening from the mayor of Chicago surrounding the increased impact, the disproportionate impact on African Americans there and in New Orleans. So we have to have the data, and we encourage that data now. We want to be proactive and predictive in targeting particular communities with the resources that they need. We want to make sure if we see a disproportionate impact anywhere, that testing occurs there earlier. So this is a very important piece of the COVID-19 pandemic, and we really urge standardized and robust collection of data across the board. And here we have early evidence that we need to pay particular attention to race and ethnicity. Now, it's not that we think that African Americans are more susceptible to this, but pre-COVID-19, African Americans and others from communities of color had a disproportionate share of hypertension and diabetes and obesity. And those are risk factors for increased morbidity of the impact of COVID-19. So this is an area that needs and deserves amplification, and the AMA will continue to do so. And as we get the data, we will work with, of course, everyone. This is an all-in effort to make sure these issues are addressed.
And what are your thoughts on antibody testing for COVID-19?
Yes, so we are and have been way behind on testing. And so we need to make sure that we ramp up the availability of testing. And of course, that does include antibody testing. Of course, that gives us data and evidence around those who may have had a mild case of the disease or might not even have experienced symptoms at all. And of course, we know there is some promise and hope, it's happened in other disease states, to be able to use convalescent serum, as they say, for treatment. So that is a critical piece of the puzzle as well. So testing, we cannot forget about testing as we are in this acute mitigation phase. Some of our most important basic public health principles remain critical, and that's testing and surveillance and tracking and contact tracing when possible.
The CDC has been revising standards for doctors and nurses as it pertains to personal protective gear. For instance, hospital employees, up until very recently, would change masks between every patient in potential infectious situations. Now, some wear the same mask all day. Are these standards being lowered to a level that puts the healthcare workers at risk?
Well, certainly the availability of PPE has been an ongoing issue in some areas. At this point, it's better. That's why the AMA called on the president early on to activate the Defense Production Act so we can really look at the supply chain and make sure we get the equipment in the hands and on the bodies of particularly those on the front line, but really everyone who needs that equipment. So we need to continue to elevate the issue of PPE. As we've said early on, physicians and nurses and everyone are really working as hard as they can and doing what they need to do in a time of crisis. We have noted that reusing masks, as per your question and some of these other issues, pre-COVID-19 might have violated infection control policies and procedures. But again, physicians and nurses and others are doing what they can in this time of crisis. But we need an all hands on deck to make sure that we have PPE, that we have ventilators, that we have the tests, including the swabs and their chemical reagents. And of course, now we're hearing about a shortage of medications that the physicians used to intubate patients. And so we really need to continue to amplify those issues and make sure shortages of any supplies are addressed.
To be sure, this is a crisis of epic proportions, and it calls for unusual responses. Reports indicate that a number of hospitals have requested help from medical students and others who may not yet have attained professional standards set by the AMA. What's the AMA's view of this, especially for students and their safety?
Well, so again, in times of crisis, in an all hands on deck moment, we've seen some states allow medical students, of course, realize that typically medical students would be graduating around the May and June time period. And so some of these fourth year medical students, of course, meeting a certain set of standards and criteria are being called into action, as well as you may know, retired physicians have been called into action. And so, certainly, again, we are in extraordinary times. That being said, and we have this information on our website, and we have disseminated this information, the AMA wants to make sure that medical students and residents are protected. And we've also offered guidance for our retired physicians who are, for the most part, older. And that, in and of itself, is a risk factor, again, for the more serious consequences of COVID-19. So, in all of these instances, the AMA has information and guidance about this on our COVID-19 resource page. We continue to be mindful of the impact on everyone, from our medical students to our senior physicians. We will continue to gather information and make sure that we are protected. Everyone is protected during this time.
Is there a need for retraining healthcare professionals on how to use ventilators? We hear much about the need for ventilators. There are a lot of physicians who might have learned how to use a ventilator at one time, but could be pretty rusty themselves on the use of it. Are there brush-up courses available for them? Is the AMA involved in any of that?
There are brush-up courses. We usually leave that to the specialties to determine and lead on those courses, but that is an excellent point. And if you have not managed a ventilator, since medical school, I know I have not. You certainly might want to do that. And that is one way we have requested that hospitals and systems support their physicians by offering them additional training as needed. We also need to keep in mind that there are so many ways that medical students and physicians and retired physicians can contribute other than direct care. Certainly, I've already mentioned the possibility of telehealth. And again, we appreciate the administration and CMS on relaxing a lot of the regulations and guidelines regarding telehealth in this time. But medical students, retired physicians, others can be available to triage for phone screening, maybe to connect with families when their loved ones are in the hospital and we know there's limited to no visitation. So there are many opportunities. And of course, physicians and medical students and residents are answering the call. We take an oath to do so. I've heard from so many of my colleagues, yes, this is an emotionally taxing time for all of us, particularly those on the front line, but for everyone. We have to actually also remember that health needs don't go away, haven't gone away. People are postponing routine and other issues, but they don't go away during this time. So we need to make sure that we continue to provide at least some platform and structure and support for physician practices, large and small. But there are many ways that medical students up through our senior physicians can answer in the call. And of course, physicians, medical students, and residents are doing so.
What's your sense of when a vaccine might realistically be available for Americans?
Well, I have to tell you, I certainly would leave that up to the researchers and the experts and Dr. Fauci. I know that there are so many researchers working on this right now. It will take a little bit of time, but has to go through the process. We want to make sure there's safety and efficacy. And so that's why in the meantime, it is so important for all of us, again, to practice those basic techniques, the physical distancing and washing our hands and only going out for groceries or for food or for medicines or urgent health needs. That is really our best tool at this point in slowing the spread of the pandemic. And we know that there are hot spots today. And you know what? It would be good if there are no more hot spots. That's difficult to predict, but the best way to prevent that is the physical distancing and the shelter in place and staying at home.
Turning my head just to read some questions that are coming in by email from those who are following us online. This may be a difficult question to answer, but how long after the number of COVID-19 cases consistently declines across the country should physical distancing continue to be implemented?
Yeah, that is an unknown at this point. Wish we had the answer, but part of that decision will be made by the data. And I believe one area that would go a long way in helping us know exactly when to relax these rules is testing. And so as we ramp up testing, those experts, those leaders, those public health leaders in the state who have all the data will be able to make those decisions. I will have to say that we shouldn't think that after we get to the apex or the peak, whatever that is, in whatever area you are, we can relax. It's not that simple. We will have to be thoughtful, and again, let the data lead us on that. But we will need to remain hyper vigilant. There will be a new normal after this. There is no question. We will get back to some semblance of normalcy. Absolutely, we will. It will be a new normal. And I can tell you at the AMA, we are already thinking about the conversations we should be having around the new normal. We're thinking about that, but that, of course, is not driving our current work. Currently, we have to be focused on preventing further spread, making sure that we are prepared for worst case scenario. Of course, not the AMA, that's everyone, states and hospitals and everyone. We want to make sure we are prepared for the worst case scenario. It's okay to hope for the best, but we should be appropriately prepared for a worst case scenario. That's how we will minimize deaths and suffering.
I couldn't quite hear you. Could you please repeat what you said?
This may be a difficult question to answer. Alcohol sales and unemployment rates are up. Are you worried that this pandemic is going to lead to more drug and other substance abuse, depression and anxiety, more suicides? What can be done to combat this right now?
Well, certainly, as you know, there are a couple of issues here. There's the issue of normal anxiety and fear. But we also know that normal anxiety and fear could evolve into clinical depression and anxiety disorders. And so we want to make sure, and I will say this as a psychiatrist, certainly pre-COVID-19, we certainly did not have the full infrastructure we've needed for mental health services. But during this period of time, there are resources available. I know my specialty society, the American Psychiatric Association have some, and others, mental health organizations have 1-800 numbers where folks can call if they feel like they are getting into trouble. Again, not the usual and transient symptoms. And of course, those who already had diagnoses, we want to make sure, and I will just remind them to stay in close contact with their physician or their therapist to make sure they are supported getting through this. I do worry, again, as you mentioned in my introduction, pre-COVID-19, we were dealing in this country with an opioid epidemic. And I've been focusing on making sure there is equitable access to treatment for those who have a substance use disorder. And so I know I've seen the availability of online support groups with this, but that is a worry. And so we certainly need to make sure that is on top of mind. I know some states have implemented a mental health hotline. I would encourage other states to do so as they can, so that any issues that come up, citizens know they have a place to go and that there is some support during this time of crisis.
Question from a member: what can we do to convince religious leaders to switch to online and phone services in place of large in-person gatherings?
Here's where we need the partnership, again, everyone, because I've seen uh, many religious leaders encourage um, uh, their parishioners and their churches and mosque and synagogues to really refrain from meeting in person. That gets back to our critical need to make sure that everyone is staying at home and sheltering in place. So here's a great partnership for uh, ministers and rabbis and pastors who know and are working within their own religious institutions to remind everyone that we all have to act together. We all have that responsibility, taking responsibility to stay at home and not. And I know this is a holy time for everyone, but we can still experience this time, or I know this is a holy time for many. We can still experience those services remotely.
What scams should people be aware of regarding COVID-19?
So my general recommendation is to always, and I actually recommend this even pre-COVID-19, is to have a healthy dose of skepticism. Ask why and ask who. I can not tell you the number of emails that I receive telling me that someone has PPE or ventilators. And I know I can imagine, I don't know, but I can imagine that hospitals, other physicians are getting the same. And so that's, again, is another reason why we need, and it would be best if we had a federally coordinated system looking at this, triaging, purchasing, distributing needed supplies again, so we wouldn't have to be so worried about these scams. But so I would ask everyone to have a healthy dose of skepticism when you are offered any equipment or anything, and really let the large systems in the state and the federal government really triage and respond to those logistics.
We've also heard about some scams involving people taking money for testing that turned out to be bogus testing. What should people be watchful for there?
I would say the same. Have a healthy dose of skepticism. Make sure you contact your local and state public health departments or your hospitals and really take cues from them. Anyone who says they have testing and they're not affiliated either with the state government or public health or hospital or physician's offices, an established physician office should really be skeptical.
Can you speak about the importance of protecting the adults and children in the immigration camps as well as in our prison community?
Yes, these are both huge issues because any issue where people are congregating is an issue. And of course, some of us have the privilege of making that voluntary decision, but some don't. And we cannot forget those who are in our prisons and jails. I'm particularly attuned to that in jails because unfortunately jails have become the de facto mental health hospital in the time, again, pre-COVID-19. So there is an obligation to have conversations about those populations. And there's an obligation for leaders and those in charge to make sure as best they can, they mitigate the risk of patients or those who are in jails and prisons and in our immigration centers, mitigate the risk of them contracting COVID-19 and spreading COVID-19. So it has to be a part of the conversation, any of our leadership conversation. Everyone deserves, basic opportunities around health. That's our obligation. And hopefully that continues to be a conversation. And just a little segue about privilege. That's a different privilege. I talked about the privilege of voluntary social distancing, physical distancing. Not everyone has that privilege. I just want to make that point. Not everyone has a large home that they could even have folks in the family be able to distance themselves. I was reminded early on in the pandemic that as we are requesting that everyone wash their hands, wash their hands, wash their hands, which we are, if you are homeless, you may not have running water. And so, as I mentioned earlier in my remarks, absolutely, if you can, walk around their neighborhood and get the exercise with family, physical distancing. But not everyone, has sidewalks and well-lit sidewalks. And so we have to make sure that we are speaking to everyone and have recommendations for everyone. And again, those who are in maybe lower wage jobs, I mentioned those who are cleaning facilities and some of those jobs, they don't have the privilege of staying at home or working from home. So that's another way that the rest of us who have that privilege can make sure that everyone is as safe as possible.
We've heard comparisons to Pearl Harbor and September 11 when talking about the COVID-19 crisis. Those instances involved moments of shock followed by understanding and retaliation. This has come on over the course of time and gotten significantly worse. Could we, under any reasonable circumstance, have been ready for what we're seeing happen now? What are some of the lessons to be learned from this?
Well, I will have to say there will be and should be after action reports after we get through the worst of this pandemic. And of course, the AMA will be there and definitely want to lead the conversation. So there will be time for that. I want to make sure we are focused right now on the immediate crisis. We want to make sure that those who are in our hotspots get through this. And we really want to prevent the rest of the country from becoming a hotspot. I will say just one lesson, though, that is clear and that needs to happen right now is, again, just coordination. I think that will be one of many lessons to be learned, that certainly the partnership and coordination is critical. But let's save a little bit of this for the after action review right now and focus on the immediate impact and the immediate needs regarding this pandemic.
You mentioned the reporters and their jobs in your prepared remarks. Let's talk a little bit about the role of journalists in helping inform the public as we all find our way through this crisis. Tell us why, in your opinion, journalism matters in a public health crisis like this.
Well, it's important to get out accurate information. And so journalism does matter. And in fact, and of course, it matters more in a crisis because people are susceptible and hearing information from a lot of sources, some of them not credible. So it really heightens the need for objective journalism. And again, pre-COVID-19, I had the wonderful opportunity to speak at a symposium with media and members of the media and journalists about reporting on the opioid use disorder, for instance, and the language and whether the language is stigmatizing. So journalism and the media have always played a role in making sure that there's credible, accurate information out there, and certainly that becomes even more acute in times of crisis.
And if you care to venture a thought, what kind of a job do you think the press is doing in covering the story so far?
I believe that there are so many wonderful journalists and members of the media that are doing a great job of getting the facts out, and I commend those who are doing a great job of making sure that the facts are there. And for any members of the media who, and I will let them do a self assessment, who are not, I hope that my words today, and of course, not just me, the team, the words from the AMA, really encourage everyone, not just the media, but everyone, to look to science. Science has been under assault for some time now, and we have to make sure that we hold up science and we are led by the science going forward. And again, that was one of the reasons, many reasons, the AMA wanted to do this address today.
There's so much to absorb and process in this crisis. I'm interested in knowing if there are particular things that I don't necessarily want to say keep you up at night, but things you think about in the course of a day and an evening.
There are a lot. Um, I worry about patients. I want to make sure that we are ready in a worst case scenario. Physicians and again, other health professionals are ready in a worst case scenario to offer them the services that they need. And I want to say, just make a plug for understanding public health. Public health is somewhat difficult to understand because public health works when nothing happens. And you have to take in that moment, nothing happens. And that's a good thing. And I that's one lesson that I hope again we learn is the importance of public health and a good public health infrastructure, and that and it's always hard to prove a negative, but certainly when the worst doesn't happen, it's going to be a combination of our individual actions, but those individual actions, the recommendations about staying home, are informed by good basic public health practices. So I want people to know about that. But I'm most worried about the patients who are at risk. And I want us as a nation to do everything possible. I worry about my colleagues. As I said, I believe perhaps in one of my addresses since I've been president, physicians don't run away from problems. We run towards them. But there's an accountability contract there that as we are running towards these problems, we accept some level of risk when we choose this profession. But there's an accountability contract that when we do, everyone else is making sure that we are safe. And it's about physicians, but it's also about their families. It keeps me up at night and I worry. Again, I could go an hour with all the things that I worry about, several hours. But it's been heartbreaking to hear my colleagues talking about updating their wills or writing a will. It's been heartbreaking to see them live apart from families, and so I want to make sure that physicians, we are a trusted profession. We will always strive to do so. And I think I want to make sure that we, not just physicians though, but all healthcare workers are protected during this time of crisis. And I do worry about the disproportionate impact in an earlier question and on communities of color. I worry about those in under or low resource areas. It wouldn't take much in an area that doesn't have a hospital or it has a tiny hospital that covers a lot of rural areas, may not have broadband. So I worry about those communities who may be low resourced or under resourced. So those are just a few of the things that I worry about.
Thank you. Our time is up. Dr. Patrice Harris, we'd like to present you virtually with our notable National Press Club coffee mug, along with our hope that we can share a cup of coffee here at the Press Club in person in the very near future. Thank you for joining us today.
Thank you for having me, and thank you. I will enjoy that mug.
My thanks to our National Press Club production team. To all, stay well, stay safe, and have a good day.